surgery. That's not an option I think most of us would care to have. I think most of you in here probably have children, and I hearken back to my days when we had our first child. Everyone tells you how it's going to change your life, and you go, yeah. People keep telling you, but until you hold your first child in your arms and you realize the innocence and the vulnerability and the complete reliance of that child on you, it forever changes your life. And you'll do anything for your child when your child is sick or ailing. I can remember when our children were sick, you wish that you could take the pain from them. Well, when you have a child who's got this terrible seizure disorder or epilepsy, and you're out of options, why wouldn't we allow medical marijuana? There are 24 states, the District of Columbia, Puerto Rico, and Guam have all passed medical marijuana laws. There are 12 additional states looking at it right now. My case to you colleagues is that these states, they're not stupid. They have the same concerns. These legislatures, the people of those states have the same concerns that we have. Some of them have done their programs better than others. Some of them have done some pretty dog-dumb kinds of things. And that's the beauty of this, is that those who've gone before, we can adopt what was good about their laws, and we can see what was bad and make sure we stay away from those. I believe this to be a solid law. It's going to prevent abuse. Doctors will only prescribe for a specific set of circumstances and diseases, and this medical cannabis board is going to review those ailments on a quarterly basis. And it's just we made sure that this was a rock-solid, tight program. Those that would argue that this is a slippery slope and it's a camel with its nose under the tent, I adamantly oppose that. This is not a law enforcement issue. This is a health care issue. And Nebraskans, we ought not be making them beg for help and beg for treatment. So colleagues, I highly encourage you to vote yes. We've talked to Senator Glore about his amendment. We're willing to incorporate everything that he's got on this amendment between general and select file, and any other inputs. We've solicited inputs from the Attorney General, the Department of HHS. We've talked to the AMA, the pharmacists, the industrial security folks. We've asked for input. We've begged for input. We've talked to a lot of doctors offline because the AMA wouldn't get on board, but a lot of doctors have come forward. We've tried to incorporate those concerns into our bill, and we're willing to do so in the future. So, colleagues, for the moms, for all the sick and ailing people in Nebraska who are out of options, I beg for your support on this bill. This is not about stoners getting high. This is about medicine and helping people. Thank you, Mr. Lieutenant Governor.
Thank you, Senator Garrett. Senator Gloria, you're welcome to speak to your amendment.
Thank you, Mr. President. Good afternoon, members. And I appreciate Senator Garrett's opening comments here, and I especially appreciate his opening comments last week where he said we're here to make good policy. And so my amendments, I want to make sure are understood not to be to throw roadblocks in front of this bill, but to make it better policy, to make it a better bill. This amendment specifically had to do with the section of his bill related to non-discriminatory practices against people who were using medically prescribed cannabis and were picked up in routine drug screenings by employers and whatnot. As I explained them, I guess to be problematic with perhaps some DOT regulations, airline pilots, people who work in hospitals and surgery. In either case, we've had, as Senator Garrett says, an opportunity to work with he and his staff, and he has worked diligently on trying to make accommodations. I believe that should this bill advance, he will, between general and select, make those appropriate adjustments into however he amends it to address the concerns I had in this amendment and the one that's to follow. And so with that, I would ask that AM 1564 be withdrawn.
Thank you, Senator Glore. The amendment is withdrawn.
Mr. President, Senator Glore, AM 1576 as an amendment to the committee amendments.
And I would ask that be withdrawn also.
AM 1564 is withdrawn.
Mr. President, I have nothing further pending to the committee amendments.
Senator Coash, you're recognized to speak to the bill.
Thank you, Mr. President. Good afternoon, colleagues. I want to let you know about a conversation that several of us had in the Speaker's office this morning. And I alluded to this when we talked about this bill on Thursday. I'm not confident I know where everyone in this body stands on this bill, but I think I'm a pretty good judge on the conviction of all of us. And what I see with LB 643 is Senator Garrett could put any amendment up there, and there are certain members in this room who would vote for it no matter what he put up there. And those same amendments, which wouldn't matter what he put up, that would get all that support, wouldn't change anybody's opposition either. In other words, people are where they are with the concept of LB 643. And if it's going to move, it's got to have some input. It's got to have a little bit of work put on it. And I know Senator Garrett has pledged his support to do that. But I don't see a lot of value in trying to do that right now if there isn't sufficient support to even move this to the next level. And I think Senator Garrett has worked hard enough to this point to deserve his vote on that. And what I am going to ask all of us to do is to not look at the technical aspects, so to speak, of LB 643, but just take a step back and ask yourself, can I see medical marijuana as part of the healthcare delivery system in our state, or can I not see that? And if your answer to that is yes, I'll ask you to vote to adopt the committee amendment and move the bill. And if the answer is no, to vote no on both of those as well. At the end of the day, what we'll have then is an idea of where this body sits on this particular issue. And if the majority of senators feel that this is something that we want to have moving forward, then Senator Garrett has pledged to work with those of us who would like to see this be at least the best technical policy that we can make it moving forward before it would potentially be put into law. And so I was encouraged by that this morning when we talked about it, wanted to put it on the record and thank Senator Glore. Senator Glore wants good policy. He wants this to work within healthcare. Senator Campbell, who works closely with HHS, who is charged with carrying out the provisions in this, knows what it's going to take to make it workable from that aspect. So they pledged their input, they pledged their support. I hope that with that we can end up with a bill that is workable for our state. But at the end of the day, we've got to know if this is even palatable for us here on the body, and I would ask you to consider that as you make a vote here soon. And with that, Mr. President, I would yield the balance of my time to Speaker Hadley.
Speaker Hadley, 1 minute and 40 seconds.
Yes, Mr. President, I just wanted to echo what Senator Quest said. We had a meeting in my office this morning where we had 4 or 5 people there, and it was decided that this is one of those votes that a person is either for it or against it. And I do appreciate the willingness of Senator Garrett and the people there just basically to say the amendment is basically the bill. So if you favor the concept, you vote yes. If you don't favor the concept, you vote no. And we'll save some time. As I told you this morning, time is running out. So with that, thank you, Mr. President.
Thank you, Speaker Hadley. And thank you, Senator Coash. Senator Craig had you recognized.
Thank you, Mr. President. Hello, colleagues. I am one of the co-signers of LB 643, and I do support that and the amendment. If you're considering not voting green for this, I would just like to ask you why. I can't imagine any one of us is considering voting no because we believe that lobotomies are the best treatment options for seizure patients. I don't believe that any of us would want to prolong the suffering of people critically ill with cancer or Crohn's disease. I worry that your thought of voting no is because rather than reading the amended bill, you've instead bought into the media hype that this bill is the first step towards becoming another Colorado. Let me assure you that I would never ever vote for any bill that would come even close to allowing recreational marijuana to be legal in Nebraska. I would not support the legalization, commercialization, or retail sale of recreational marijuana in Nebraska. I simply couldn't support anything of that kind. I want to make the point that comparing medical cannabis oil to the recreational marijuana people smoke to get high is like comparing Prozac to methamphetamine. The comparisons in each case don't even come close to making sense. In each case, one drug can change lives while the other destroys them. LB 643 not only heavily regulates the kind of medical cannabis that can be prescribed, LB 643 also tightly regulates how it would be prescribed and dispensed. Only a medical professional in good standing with the state of Nebraska can prescribe CBD. Once it is determined a patient qualifies, the patient must be approved and added to a statewide registry, which would make mandatory that a picture of the patient be kept on electronic file. Prescribed CBD would be regulated and dispensed only through dispensaries associated with the manufacturer. The prescription could only be picked up and paid for by the person matching the picture in the state's online registry used by pharmacies. No match, no prescription. LB 643 would harmonize Nebraska pharmaceutical law with those of so many other states that know the difference between medical cannabis being a medical issue and not a recreational drug use one. I ask with greatest sincerity to think about the facts, think about the patients, and I hope you'll vote green on LB 643. Thank you.
Thank you, Senator Craig. Senator Brosh, you recognized.
Thank you, Mr. President, and good afternoon, colleagues. This afternoon, I have passed out a sheet of information. It just so happens after we went to through our recess last Thursday in West Point, I ran into my physician and asked her thoughts on medical marijuana. She said, "Lydia, we have medical marijuana, and it's called Marinol." And she says that she does prescribe it. It goes to cancer patients. There's many things it's prescribed for. She has two elderly individuals in a nursing home that refused to eat and ate very little, and with this prescription, they gained 10 pounds within 2 weeks. She said there's many uses, and this is FDA approved. It's here, it's FDA approved, and it's compassionate. It goes to those suffering. They use it with a lot of hospice patients, but to give it to children whose brains are not fully developed yet, our brains are growing within children for multiple years, up into your early 20s. With someone who is older, someone who is on hospice, she had said it is proven, it is working, it is FDA approved. On the other side of the flyer I gave you is a second pharmaceutical approved similar prescribed drug. What I'm afraid of is what I heard last night when I turned on the television, and I usually don't watch late night talk show hosts. But this host had announced, guess what, folks? California now has legalized marijuana. And he said, but of course, it's medical marijuana, but anybody can get a prescription. And then he had a interview with several people on the streets in California talking about this. I understand there are many very seriously ill individuals in pain, but I do understand from a medical doctor and others, we have the testimonies of several that what we are looking at today in passing here has not been approved. We don't know if we're taking those who are suffering and taking them closer to their end just by numbing or doing what to their brains. And again, these are two examples of what is being used in Northeast Nebraska at different facilities and across the country. And if you do a search, you will find other multiple pages that describe uses for almost all of the symptoms that you're talking about in this bill. You go to the symptom and there is something there. And yes, my heart bleeds for those mothers and children in pain, and I do believe that mothers and parents, fathers as well, are desperate to help their children, but to what means? Are we in such a hurry that we would bypass the medical approved marijuana drugs out there today and decide that, yes, we need to take the political process and mix it with the marijuana industry? You know, it was a joke about California last night. Nebraska is not a joke. What we need to do is look closer, look at all the facts, all the options, and until we have a surety that what we're giving our children is not going to harm them, harm their mental development moving forward, I encourage you to not rush forward, but to take a look at what we have here. Call your physician. I spoke with mine. Thank you, Mr. President, and thank you, colleagues.
Thank you, Senator Bryce. Senator Ken Har.
Mr. President, members of the body, I want to thank Senator Garrett for his compassion and for his leadership on this issue. I do see medical marijuana as an important part of healthcare policy in Nebraska. And there was an article in the Kearney Hub by William Avias, who's a professor in the Department of Political Science at the University of Nebraska at Kearney. And he said some things pretty well. So I'm going to be quoting a little bit from that article that appeared in the Kearney Hub. In 1937, marijuana was nationally prohibited largely on the basis of misinformation and half-truths. And by the way, it was also turned into devil weed at about the time Prohibition ended. And the alcohol industry invested a lot of money in painting that new image for marijuana, which had been used by an awfully lot of people during Prohibition. The current debate in the unicameral over the Cannabis Compassion and Care Act has fortunately not fallen to this level of disinformation, but some of the claims and concerns raised are misinformed. First of all, opponents claim that marijuana is dangerous. And we're not talking here about recreational use, we're talking about medical use. But obviously, in this country, a lot of people use marijuana illegally. And yet, there are no recorded cases of death by overdose of marijuana. Compare this to the surprising number of deaths from the overdose of drugs like OxyContin and those kinds of things. There's a great deal of evidence that cannabis has medical benefits from its historical use as a medicine in the United States. In 1999, the Institute of Medicine of the National Academy of Sciences concluded after a review of the research that many patients suffering with HIV/AIDS, glaucoma, cancer, epilepsy, and other debilitating sicknesses found that cannabis provided relief from these symptoms. Since 1999, numerous studies have buttressed these claims, with one 2012 review of the research in the Open Neurology Journal finding that cannabis was likely useful in managing neuropathic pain and the symptoms associated with multiple sclerosis. One study in 2014 in the Journal of American Medical Association found a correlation between the existence of miracle marijuana laws and the reduced rate of opiate deaths by nearly 25%. In other words, in those states where there's the use of medical marijuana now, the number of opiate deaths by those kinds of drugs has fallen by nearly 25%. Finally, since 1996, when California was first to enact a medical marijuana law, we have been able to assess the potential consequences to teen use of cannabis that opponents claim is a reason to stop LB 643. Numerous investigations have found no connection between medical marijuana laws and increased cannabis use by teens. And the charge, of course, that doctors will just prescribe this to anybody doesn't give much faith to doctors, I think. So LB 643 represents a relatively tight regulatory proposal that's unlike the loosely regulated systems in states like California and Colorado. Patients and caregivers must go through a thorough process to obtain access to the plant, and those who will be allowed to produce and deliver the drug will be limited to a selected few. And with that, again, I would like to thank Senator Garrett for bringing this bill to the legislature. Thank you.
Thanks, Senator Harr. Senator Chambers, you're recognized.
Mr. President, members of the legislature, I feel about this bill the way I imagine people would feel who have a heart. I don't have one. So my emotions are not something that I have. I've heard about them. I've seen them at work in people, and sometimes I think they're good, and sometimes I think they're not. But the model I would take is that fellow called Spock and Star Trek, where you look at a situation, you can weigh it and determine that which is probably the best direction to go. So I already told Senator Garrett that he's for the bill because he has a heart. I'm for the bill because I have none. But my brain is what works with me. Nature wants a species to be propagated. So the adults take care of the children. And you don't want to get between a mother and her babies. So if there are babies already here, and by babies, I don't just mean infants and toddlers, but children, and they are suffering unnecessarily, my mind tells me that something should be done about that. I saw where not long ago that the polio virus is used in a drip to get rid of tumors that people have in their brain. They take away part of the skull, and they let this drip come right on the affected part of the brain, and it has cleared up these tumors. Who would have thought that a polio virus could be used in such a wholesome manner? On the other hand, I turn on television and I see these pharmaceuticals advertised, and they'll say this could cause excessive bleeding, stroke, pancreatitis, and it could be fatal, but you can buy it. And not one of these pharmaceuticals that's advertised on television where it's by prescription, will they not list a group of side effects that are worse than what you're suffering from? Because in many instances, the medication can kill you, whereas what you're taking it for will not be fatal. I don't know how many people have watched little children who are in great pain, but what they will often do with their sad, little pain-filled eyes is look toward an adult as if to say, you're supposed to be able to help me. Now help me. I've seen commercials for that St. Jude Children's Research Hospital. They had these little bitty babies, all of them got cancer, and this one little one, his hair was gone. He was against the chest. I don't even know if it was the mother or father, a male or female, but you could see the child. The eyes were half open. And when he closed his eyes, the lids closed very slowly, opened very slowly. Then he raised his head to look up at whoever that adult was, as if to say, while I'm here, then I'm all right. There's comfort here. And we as legislators can do all the talking that we want to, of the kind that Senator Brosh gave us, which I think is meant the way she gives it. But if you see a child hurting, here's my feeling, since I only have less than a minute now. If I knew somebody, especially if it was somebody close to me, who had one of these ailments, and I could get some marijuana and risk going to jail to get that marijuana, if it was my child, I would go to hell 10 times, die and go to hell 10 times to help my child. So I'm supporting what Senator Garrett is doing, because not only am I brother's keeper, I'm my children's keeper. Those are our little brothers, our little sisters, and this is something that will help them like nothing else. Their back is against the wall. They can only improve. This offers that, and I'm supporting it. So I will vote for it here. I signed onto that paper, and I intend to stick all the way. Thank you, Mr. President.
Thank you, Senator Chambers. Senator Bloomfield, you're recognized.
Thank you, Mr. President. Good afternoon again, colleagues. We have been asked to consider rushing to judgment on this bill. Maybe we shouldn't debate it as long as we might, because we're running out of time. Colleagues, this is one of the most important bills we had before us this year. We had the death penalty, which is important. We had the budget, which is mandatory. Prison reform, which had to be done and is in the process of being done. And this as an issue. The idea that we should limit debate on this because we're running out of time doesn't appeal much to me. This is too important a bill to rush to judgment on. If you have made up your mind and there's no change in it, fine, so be it. But if you have even the faint lingering doubt, if we are going to rush on this, then vote in favor of it. Get the rest of your answers between now and select. Don't vote automatically no on this and regret it day after tomorrow. Senator Brosh brought up the education of people, young folks going forward. Colleagues, if your child is having 100 seizures a day, you're not worried about their education 10 years from now. If this is something that may help, we owe it to everybody that's afflicted with these kinds of things to consider this carefully and fully. Again, don't rush to judgment. Don't vote no because it seems the political thing to do. Give this serious thought. It is a serious issue. I have decided that since this has been taken down to a pill form or an oil form, I am going to support this bill as it is, as amended. When it first came out, I was not on board. I didn't see any way I could get on board, but it has gotten to that point. But let's not shortchange this decision because we're in a hurry. We have the death penalty left. The budget is pretty well a done thing. We've got some more votes on prison reform, but we've got time enough to get this done and still give this a consideration, the proper consideration, without a big rush and depriving us of all the information that should be made available to us. Thank you, Mr. President.
Thank you, Senator Bloomfield. Senator Christ, you're recognized. I don't see Senator Christ at the moment. We'll pass over. Senator Pansing Brooks, you're recognized.
Thank you, Mr. President. I just wanted to add a couple more things. I support the amendment from the judiciary and the underlying Bill 643. Senator Brosh passed out some information on a drug called Marinol that has some ties to the chemical compounds of marijuana, and that is to ease neuropathic pain. What I've heard is that we have it, but we really don't have it because that Marinol does not have the cannabidiol oil that is supposed to help some of the pain management that is found in the medical marijuana. So again, I think Senator Brosh talked about not giving it to kids whose brains have not fully developed, but when you think about it, what is happening to those kids that are having hundreds of seizures a day? I'm not saying it should go to every single child, obviously not. But if a child is being given the choice, or a parent is being given the choice of brain surgery or chemo or radiation, all of which are toxins that go into the body, shouldn't we allow a doctor to also have in the tool chest the choice of medical marijuana? This seems like such a ridiculous discussion in a way, because of course opiates are completely dangerous and addictive. In fact, we've passed a bill this session to deal with that. We have the Good Samaritan bill, and that is to deal with addiction and overdose. We know it's happening, and it was a good bill. But the people that came to me on that were people whose family members were addicted to opiates because of pain management. And so they said, please pass this bill so that we can have this medication in our homes so that we could possibly save their lives. So these are opiates where people are addicted to it all the time. We're talking about something that has proven never to cause an overdose, ever. And we have testifier after testifier that says not only does it help, it has significantly decreased seizures. It's significantly helped in pain management. Again, medicine is as much an art as it is a science. So why we would have any concern and be sitting here arguing about whether or not one tool should be in a doctor's tool chest, I don't even get it. We're legislators, we are people helping to figure out laws. Nobody asked us whether heroin's okay or morphine is okay for somebody who's in the last months of life and in significant pain. We aren't sitting here deciding that specific chemical compound. But oh my gosh, because it's tied to a natural plant that people abuse recreationally, no doctor should have this in the tool chest. What about all the other things? Let's start getting rid of everything that people abuse. Methamphetamine, opiates. We have so many drugs that people abuse, so we should get rid of them rather than providing them access to physicians who may be able to use them to help a patient significantly. I appreciate the fact that the speaker and others have gotten together to let us go forward on this and give a vote. I hope that everybody will say, yes, this is something that's positive. I give the rest of the time to the speaker if he'd like it to explain again what that decision was about.
Thank you, Senator Pansy-Brook. Mr. Speaker, 1 minute.
Yes, just real quick. Thank you, Mr. President. The amendment is the bill, and as Senator Coash said, I think people have very strong opinions, and just a signal of whether Senator Garrett should put the time and effort to make sure that we have the correct bill when we move forward, or that if the will of the body is it's not, then that will be what the body cares about. Thank you, Mr. President.
Thank you, Speaker Hadley. Senator Hilkeman, you recognize.
Thank you, Mr. Speaker. I'm a little surprised at myself standing up here today, because when I first saw this bill, I thought, no way am I ever going to support the possibility of medical marijuana being authorized in the state of Nebraska. But a little bit like Senator Garrett said, over the last weeks and months, we have all met with the people who feel that they would be, that their life would be improved if they had the availability of the medical marijuana. And so I've had a change of heart also, Senator Garrett, in that I think that we should consider this. If you want all of the data, having been a medical practitioner, I can show you all the data as to why we should not do this. The DEA has a position paper on the marijuana, which tells us there's a lot of things that we haven't proven, and the science isn't there. And then I've downloaded things from the Cancer Association and from the ophthalmologist for glaucoma and so forth. I have visited with physicians who've practiced in Colorado, and we do not want a Colorado here. I can guarantee you that. But I've come to the conclusion that I've got some questions that need to be answered, Senator Garrett, and if we can get good answers to them, I'm going to implore this body to consider that we might want to start this route. And Senator Garrett, I'm wondering if you would answer a couple of questions for me.
Senator Garrett, would you yield, please?
Yes, I will.
The very first question is, why have we now settled on the Minnesota model? Because this is the one model that's not been tested yet. You know, they haven't even implemented it yet in Minnesota.
The Judiciary Committee looked at the bill, and they felt that one gave them the best option. Quite frankly, my personal opinion is because it didn't allow smoking. There are only two state laws, medical marijuana laws, that don't allow smoking: New York and the Minnesota law that's in the process of being implemented. And New York's law is not very good.
Okay. Number two, Senator, one of the things when you gave your splendid introduction of this bill, you said chronic pain had been removed as one of the criteria. Why was chronic pain removed from this bill?
There's always been concern about pain and how you quantify pain, and again, we wanted to keep this a very limited number of ailments and diseases. I personally believe that chronic pain should be included, but we'll let the Cannabis Medical Board review and make the determination about which ailments and diseases should be added.
Another question, Senator, how many doctors do you think would be, that will eventually be prescribing this medication?
We are not going to force this on a physician. A physician would have to agree to want to be able to prescribe medical marijuana and agree to abide by the rules of this. So it's hard to quantify, but my own personal experience with my father-in-law and just talking to some of our colleagues here on the floor, Doctor, I think a goodly number of doctors would agree to participate in this.
Will these doctors have to take special training for this purpose?
Not special training, but they would have to review what the rules are and the very specific ailments and diseases that they can prescribe this for and agree to abide by those rules.
And will those doctors have to make application to our health department to be a part of this program?
Yes, and they'll be a part of a review to see what they're prescribing for and the number of patients.
And Senator, how many pharmacies or how many distribution centers might there be across this state?
Currently, the bill calls for 2 manufacturers to be selected competitively, and each manufacturer is allowed to have 4 dispensaries. We can adjust those numbers however we like, but currently envisioned, there would only be 8 dispensaries statewide.
8 dispensaries statewide, and they have to have a prescription. Thank you, Mr. Speaker.
Thank you, Senator Hilkeman and Senator Garrett. Senator Repa, you're recognized.
Mr. President, senators, and viewing public, it's a dangerous position for a legislature to practice medicine. I've spoken with a number of physicians whom I have worked with and trust over many years. I've also spoken to a number of pharmacists. I am concerned with LB 643 and the pending amendments. I am concerned with the FDA has not approved marijuana for medical use. The FDA has not found any such product to be safe or effective for the treatment of any disease or condition. The use of untested drugs can have unpredictable and unintended consequences, and the FDA-approved drugs have been carefully evaluated for safety, efficiency, efficacy, and quality, and are monitored by the FDA once they are on the market. It is important to conduct medical research into the safety and the effectiveness of marijuana products through adequate and well-controlled clinical trials. The FDA has received reports of adverse events in patients using marijuana to treat medical conditions. I would remind my fellow senators that the FDA is not interested in restricting any reasonable drug to patients. They are not trying to compromise these patients, but rather to serve the interest and well-being of these patients. I feel that we're caught up in the wave of what is going on, and that the emotional piece. I too have met with a number of families, but you cannot make policy on a limited number of folks. I add to that my late wife, as many of you know, had multiple sclerosis for 17 years. And there was not a time in those 17 years that she or her physicians felt that anything like medical marijuana was the answer for them. Thank you.
Thank you, Senator Repe. Senator Keene announces the following guests are visiting the legislature today: 34 fifth graders and 4 teachers from Sandy Creek School from Fairfield, Nebraska. If I can ask those students and teachers to please rise so we can welcome you to your Nebraska legislature. Senator Garrett, you're recognized.
Thank you, Mr. Lieutenant Governor. Colleagues, I get it. Senator Repe, Senator Brosh, Senator McCoy, Senator Williams, I get it. I too am concerned about the health and welfare of Nebraskans. I have never smoked marijuana, I've never used drugs, I don't drink alcohol. I get the concerns, but I got to tell you, Senator Brosh mentioned Marinol, which is a synthetic form of marijuana. But if you look at the list of side effects for Marinol: changes in mood, delusions, seizures, pounding heartbeat, restlessness, nausea, vomiting, gastrointestinal, abdominal pain, heart palpitations, fatigue, muscle pain. You cannot watch television without every other commercial is for pharmaceutical that has a longer list of potential side effects than what it's curing. And as far as the FDA approval goes, I have a list here of 35 FDA-approved prescription drugs that were later pulled from the market. Some of them, like Accutane, were on the market for 27 years. The FDA doesn't always get it right. The FDA can't even test medical marijuana because it's a Schedule I narcotic, and the DEA has the hammer on that. Again, medical marijuana was part of the U.S. pharmacopoeia until 1942. And for those of you that were here on Thursday, I told the story of my father-in-law, who in 1978 had pancreatic cancer, was undergoing aggressive chemotherapy, and was so violently ill because of the chemotherapy with nausea and loss of appetite. And his oncologist told him at that time in 1978, hey, if you can get a hold of some marijuana, it'll really help with the side effects of chemotherapy. And so my sister-in-law went out and acquired it, and it did exactly what the doctor said it was going to do. That was almost 40 years ago. Colleagues, 40 years ago, and an oncologist knew that then. One of one of you fellow colleagues out here, and I won't name him, but when I was walking around talking to you all, one of our colleagues here was telling me the story in 1971 when his grandfather was sick with cancer in a VA hospital, and his grandmother, knowing he was in college, asked him to procure him some marijuana. Colleagues, we've known this for a long time. It does have medical efficacy. This is a naturally occurring herb, and it's not the panacea. It's not going to be a cure-all for everybody. Not every doctor wants to prescribe it, and not every patient wants to try it. But if you are out of options, like so many of our fellow Nebraskans are, out of options, why wouldn't we avail ourselves of this opportunity? Why wouldn't we give them a chance? You know, this Charlotte's Web CBD oil that they've done in Colorado, Charlotte, Fiji, who's having 300 to 400 seizures a week. They had a do not resuscitate order on her. One drop of this CBD oil cut her down to 1 seizure a week. That's phenomenal. This isn't going to work for every child, but it certainly worked for her. And it certainly worked for a lot of others. And again, I'm not a big conspiracy theorist, but ladies and gentlemen, Big Pharma has got their fingerprints all over this. You know, when Sherry Lawler's daughter is getting $35,000 worth of medications every year, and she's on Medicaid, so we, the state, are paying for that, and they're not working. You know, God bless the pharmacy companies. They create a lot of great pharmaceuticals that do a lot of good things, but they're not always effective, and they come with lots of side effects. You know, a lot of veterans have PTSD. The VA is prescribing opiates like they're going out of style.
1 minute.
And these guys are thank you, Mr. Lieutenant Governor. These guys are walking around like zombies. Medical marijuana would give us an alternative to those opiates. I've had 2 major abdominal surgeries. I can remember the excruciating pain I was going through, and I forget what the pill was, but this tiny little pill that I took for pain, I would never take it again because it put me in la-la land, and I don't like being out of control. And so many of these pharmaceuticals they've developed have so many terrible side effects. Medical marijuana, again, colleagues, 24 states, the District of Columbia, Guam, Puerto Rico have gone ahead of us. They've weighed the conditions and everything. They're not stupid. I can't argue why it's taken the FDA so long to do this or the DEA, but colleagues, Nebraskans are begging for help.
Time, Senator.
Let's help them.
Thanks, Senator Garrett. Senator Keene announces the following guests are visiting the legislature today. 24th graders and 1 teacher from Axtell Community School in Axtell, Nebraska. All of those students and teachers are up in our south balcony. If we can ask them to please rise so we can welcome you to our Nebraska legislature. Senator Mello, you're recognized.
Thank you, Mr. President, members of the legislature. First off, I'd like to start off, I've tried to listen to some of the debate last week and came up a little bit this morning late when people were starting to debate on LB 643. And I understand that good people can disagree in regards to some of the policy considerations that are wrapped up in this underlying bill. But I understand that we may be on this for a while and may be considered a test vote, and I understand that the work the Judiciary Committee did to bring LB 643 out to be debated was honorable to be able to allow this body to have a conversation about this policy. Now, I know, as we've always said on the floor, look, I'm not a doctor, so I can't speak to a lot of the medical components that I've started to hear a little bit of the discussion last week and earlier today on, but I tried of any issue I probably wrestled with in my 7 years in the body, this is probably one that's hit me probably more closer to home, being the son of an epileptic. And it's something that I've been thinking about all session in regards to bills that come in front of us that have sometimes profound and sometimes very mundane impacts in our day-to-day lives. And this is a bill that, growing up with a mother that continues to have epilepsy today, I can only express to you the experience that I've had of seeing epilepsy up close and personal. And I can't imagine what it'd be like to have a child with some of the epileptic seizures that I've heard from families over this session in regards to how they try to live and cope day to day. Colleagues, I understand that the Judiciary Committee Amendment AM 1254 may not be the silver bullet that Senator Garrett was looking for. It may not be the perfect policy that this body is considering. And arguably, people may oppose the amendment in the underlying bill, and that is completely within everyone's realm. And I'm not going to fault anyone for a position they take on a very difficult issue like this. But I have to assume there are other 35-year-old sons across Nebraska with a parent with epilepsy who probably have grown up very similar to the way I have in regards to dealing with that very difficult medical circumstance and how a family has to cope, how a family has to change their day in, day out lifestyle to address the medical needs of a loved one. And I could only hope that while a passage of a bill like this may not ever provide the treatment, it may not ever provide the care that my mother would ever need, I know that there are children out there who need this care. I know there are families out there who need this care. And I think Senator Garrett last week in a very bold, very striking comment said, by God, we got to do something. And my hope would be that we could do something, colleagues. That we've had plenty of bills in front of us in my time in this body that are difficult to negotiate, they're difficult to craft, they're difficult to find common ground. And I think Senator Garrett's gone out of his way to work this bill with the Judiciary Committee throughout the entire session to get something for us to at least debate and discuss. If we pass this bill from general select file and it's not perfect, I've committed to Senator Garrett, Senator Koash, I'll work with them to find a way to get the bill in a more appropriate shape, and I know other senators would too as well. But I just refuse to accept the argument that it's too difficult, there's not enough time, we have too much work to do for us not to try to take action on such a critical issue that impacts children and families. Colleagues, we deal with emotional issues every day in this body. And obviously, the concerns I've heard from some members in regards to the potential impacts that a bill like this would have on the greater good of society, I think it's their opinion. It may be a little short-sighted. It may be a little misguided in regards to why you would oppose or support a bill.
1 minute.
But I think we can all agree that Senator Garrett has raised an issue to this legislature that can't go unnoticed any longer. That there are too many children and too many families who are trying to deal with unbelievable circumstances and are looking to us to provide some ounce of compassion, some ounce of care to help them make it through their days. I thank Senator Garrett for bringing this bill. I think he's trying to do the right thing. I think he's trying to help people. And it shouldn't go unnoticed that no matter what happens on this debate, that the issue is not going to go away, that there are parents, there are children who need our help, and one way or another, we've got to find a way to help them out. Thank you, Mr. President.
Thank you, Senator Mello. Senator Brosh, you're recognized.
Thank you, Mr. President, and once again, good afternoon, colleagues. I do want to be on record today to voice several concerns with LB 643. However, I do not want to start with my concerns on the technical aspects of the bill as amended by AM 1254. Although I certainly could do that as I review the amendments that are riddled with a number of red flags and questions I believe that the legislature still needs answers for. Instead, I want to begin by addressing the concerns of medicine and science. The medicine and science of medical marijuana. My concerns aren't because of reefer madness, but the real concerns that were documented from reasonable individuals from our medical science community. I believe they have a lifelong vested interest as physicians and doctors in our well-being. Colleagues, if you take a look at the committee hearing report, you'll see a number of concerns that were voiced by the Department of Health and Human Services, the Nebraska Medical Association, and the Nebraska Pharmacists Association. In addition, as I did additional research on the issue, I came across serious concerns from the Academy, the American Academy for Pediatrics, the American Medical Association, and the American Pharmacists Association. And I want to offer the concerns of these entities. All of these organizations recognize that there is insufficient scientific objective research on medical marijuana and the negative or positive medical effects the drug may have. For example, the American Pharmacists Association stated the following, and I quote, "While a number of studies and publications examine medical marijuana use, most are anecdotal or a series of case reports. Very few of these research studies have used scientifically vigorous and valid methods or well-constructed research designs to assess the safety, effectiveness, or long-term use of marijuana. In addition, these studies have not been subjected to the review and evaluation of the FDA that would give to research for drug products being considered for market approval in the United States. The state laws authorizing marijuana for medical purposes have been passed largely as a result of public opinion." I want to repeat that. They're passed because of public opinion rather than scientific evidence. While public opinion and scientific evidence are both important and relevant, as a legislature and as a society, we have not traditionally allowed for the use of drug products without adequate scientific evidence. The lack of this scientific and objective evidence raises additional questions regarding issues such as efficacy, potency, dosage, and others. For instance, the Department of Health and Human Services testified on the bill and stated the following: "While trying to establish a correct, safe dosage, safe length of treatment, and the best routes of administration, researchers and practitioners in states that have legalized medical marijuana have been somewhat frustrated in their research because of the ever-changing chemical composition, the various potency of the plant through genetic manipulation." There are numerous reports that talk about adverse effects. I'm not concerned about the brain because of education, Senator Bloomfield. I'm concerned about the brain because that is our sign of life. When there is a critical accident, we look to the brain for life. Those children need life moving forward. And if we're not going to consider their life, then we have no right to discuss this. It's their parents, their personal parents' decision. However, we cannot resort to rushing into the use of what's considered an illegal drug in our country that has not had the scientific and medical community. Thank you, Mr. President.
Thanks, Senator Brosh. Senator McCoy, you're recognized.
Thank you, Mr. President. Members, Senator Garrett yield, please.
Senator Garrett, would you yield, please?
Yes, I will.
Thank you, Senator. In AM 1254, the physicians don't actually prescribe the medical marijuana, correct?
In the bill, the physician would be required to prescribe.
No, in AM 1254, they don't prescribe. They just recognize that a patient has one of the medical conditions. The pharmacist and the actual patient prescribe the amount, the frequency, and the usage of the medical marijuana, correct?
Yeah, it's a recommendation, not a prescription.
So how would that work in practice? So we're talking about, we're saying medical marijuana, but in reality, the physician's not actually involved. The physician is just there to recognize that one of the symptoms for which the medical marijuana, quote unquote, could be used is present in the patient. But the physician is not actually connected with any, doesn't have any sort of a physician-patient relationship in that in that relationship going forward as far as the actual prescribing of the drug, correct?
No, they would have to be a part of the program and agree to abide by the rules.
How is that so, and where is that in the amendment, Senator Garrett?
Well, short of digging through it right here, I can certainly get with you offline and show you that, but the Medical Cannabis Board is what reviews the various systems and ailments and the strength and
But
composition.
Senator, let me stop you there, but I'm talking about specific patients, not overarching. On a specific patient, in the type of physician-patient relationship, which you would have or I would have, any of us have probably had at some point or another, when we go to a physician for some sort of an ailment and we ask for relief, a physician prescribes a drug. That doesn't exist in AM 1254. Does it, Senator?
You're asking a very specific question. I'd have to look back in the bill, but the intent certainly is that a physician would prescribe marijuana for whatever symptoms the patient has.
But you had said to an earlier question, Senator Garrett, that you wished and would hope that the Compassion Board would include chronic pain in the regulations going forward, correct?
Well, at some point, it's not in the bill as it stands, but the intent is the Medical Cannabis Board would review findings from other states and other research and make a determination as to what ailments, up to and including chronic pain, might be added to the
And are you hoping that the Compassion Board includes the ability to smoke whole leaf marijuana also?
You know, I've said from day one, I'm not a doctor, don't claim to be one, but I would like doctors to be able to describe the modality. There are only 2 states of the 24 that don't allow smoking. Those are New York and the Minnesota law. So obviously some physicians have determined, and in fact from what I've read, that smoking sometimes is the best way to deliver the medicine because it gets in your blood system quicker via your lungs.
So you're hoping that that under AM 1254, the Compassion Board would have the ability to include chronic pain and the ability to smoke marijuana as part of the regulations.
I'm not hoping for anything, Senator McCoy. All I'm saying is
No, what I'm asking is they would have that ability to set up those regulations under AM 1254.
They would review what ailments you could prescribe it for and the dosages and the delivery.
So really, we really are being asked for a test vote here. This is what you're telling me, Senator. We're essentially saying this board, who we're going to authorize through this legislation, is going to decide all these intricacies of the implementation of this policy, and we in the legislature, the duly elected 49 members of the legislature, really aren't going to have that ability.
That's not true.
How would we have that ability?
Well, because the members that the governor appoints to the Cannabis Board have to be approved by the legislature. One person from each congressional district, a physician, and a pharmacist.
But that board will have the ability to determine the policy of whether or not it's chronic pain, whether or not it's smoked, and all of that, correct?
Yes, leave it to the experts.
Thank you, Senators McCoy and Garrett. Senator Bloomfield, you're recognized.
Thank you, Mr. President. It's been pointed out to us that a lot of us aren't doctors. Therefore, we probably shouldn't have an opinion on this. Colleagues, I'm not an accountant either, but I had to vote on the budget. I'm not an attorney, but I had to vote on prison reform. Colleagues, we are sent here to do what we believe to be in the best interest of the people of the state of Nebraska. That's what we're charged with. We cannot all be airplane pilots so that we understand everything about aviation. Thank God we're not all truck drivers so we understand some of the transportation rules. But we gather up the information as best we can and we make a decision. we're referring to this as medical marijuana. I wonder how it would be received if it was made out of corn oil and had the same properties, or out of soy oil, or out of beef tallow. You suppose we could get the FDA to study it then? And maybe we get some findings that we could actually deal with, instead of struggling with what is admittedly anecdotal. Colleagues, when you have enough people telling you that something helps, it's time to look at it. When you have a few people that are in the pharmacy business telling you, oh no, that can't possibly work. Well, we haven't studied it, but it can't possibly work. You know, the scientists told us for years that bumblebees can't fly. I haven't seen a lot of them walking when they travel where they go. So again, consider this carefully. No, if we pass a law, it probably won't be perfect. But let's see if we can't get a step in the right direction. I'd yield the remainder of my time to Senator Garrett.
Thank you, Senator Bloomfield. Senator Garrett, 2 minutes, 15 seconds.
Thank you, Mr. Lieutenant Governor. Thank you, thank you, Senator Bloomfield. Again, colleagues, this is not a perfect bill by any stretch of the imagination. We worked tirelessly and mightily on our original bill, and we've worked on this one. It's not a pretty baby. As a matter of fact, it is an ugly baby, but it is our baby, and we will make it work. I'm convinced, I said the first day of my opening statement, I'm a deeply skeptical person. It's in my DNA, and my profession has taught me to perfect that skill of being skeptical. But I got to tell you, colleagues, that the research is out there, and I'm not going to sit here and tell you about the research in Tel Aviv University. You know, the fact of the matter is, we can't research it here in the United States because it's a Schedule I drug. And the DEA has to take it from being a Schedule I federally before we can actually research it. But you know, it's interesting that there are things in the American Medical Association. A 2014 study in the Journal of the American Medical Association found a correlation between the existence of medical marijuana laws and reduced rates of opioid deaths by nearly 25%. We've got lots and lots of evidence like that. There's, colleagues, we are not Colorado. We are not California. We're Nebraska. We're not gonna implement a law that's gonna let these things get out of control. This is a solid bill. We've asked for input from anybody and everybody to make it better. Between general and select file, we will incorporate Senator Glor's comments and anybody else's comments. The bottom line is, help us make this as great a bill as we can possibly make it, and help the Nebraskans who are out of options. Thank you, Lieutenant Governor.
Thanks, Senator Garrett. Senator Hilkeman, you're recognized.
Thank you, Mr. Speaker. We ran to the end of our time, and last time I was at the mic. I want to make it clear that I'm considering this. I'm not saying that we ought to get behind this bill, because we just in the last 3 questions here, the room has gotten a little cloudy. And I appreciate the questions that Senator McCoy has provided here, because this is exactly the concerns that I've had about this bill, is how is it going to be regulated? What are the qualifications of the people who are going to do it? This could get real messy real soon. Now, as a physician, I've visited with some of my colleagues, and I've sent emails to others, and much as some of the others to say, some people, we ought to be moving forward to this. Others saying, well, it's hogwash. But I don't know if any of you heard the story over the weekend, and we're not talking about this particular bill, but I had a real heart for the mother who had her daughter removed from the airplane on the flight from up to Seattle. The child with autism, and you know, if you have a child with epilepsy or one of these diseases that could be helped with this, you would want to do everything in your power to help that individual. So I understand their passion to wanting to do this, and so if we can do this, Senator Brosh, that I want to say, and you mentioned that the people were opposed in the hearings of this. Unfortunately, the bill that was being talked about there was a bill that involved the smoking of marijuana, and this one does not involve the smoking of it. I think that there's probably a difference there. However, we've just had the interchange between Senators McCoy and Garrett that said maybe we can have smoking. This is what concerns me about this bill, is that we need to make certain that we have good controls on it. And so as we continue this conversation, I think that's the key. How is this going to be controlled? Thank you.
Thank you, Senator Hilkeman. Senator Davis, you're recognized.
Thank you, Mr. President. Colleagues, I wanted to talk a little bit about my own life and some things that I observed when I was with Senator in Colorado last year. So I think I've said this before to you, but when I was a young man, I had epilepsy. It was not severe. It was managed. But my parents, when I was diagnosed with it, we went all over the place to try to figure out what in the world was wrong with me. So I really get what's going on in the lobby with these parents who have been down that road several times, have spent thousands of dollars going to this doctor, and they end up putting people back on more and more medication. So, and then I want to talk a little bit about something that's known as H. pylori. If you've ever heard of that, that's what causes ulcers in people. And there was a doctor who figured that out some years ago, and when he put out his medical studies, the rest of the medical society said, "You've got to be crazy. No bacteria can live in the stomach. That's just absolutely impossible." Well, as it turned out, he was right, and it took him about 15 years to prove that H. pylori caused ulcers in people. So, you know, there are lots of things that we can learn about products. Senator Garrett, Senator Crawford, and I were in Colorado last year, and we saw firsthand families who were impacted by CBD, cannabidiol. And Senator Garrett made reference to Charlotte Figi a few minutes ago. That little girl, when we saw her, she was running around in the yard. She'd broken her arm playing with some kids about a month before that. And prior to that, she couldn't do anything. She was basically a basket case because she had so many seizures. There is some merit to what Senator Garrett's trying to do here. And I have been very much not in favor of it, but I've decided at this point, and I'm still not saying yes to it, but I've decided at this point it's time for the body here to say, okay, Senator Garrett, we're going to let you do what you want to do on select file. So I suggest that we vote to move the bill on and let Senator Garrett work the magic that he can, and we can have full and fair debate at that time. That's all I need to say, and I'll yield the rest of my time to Senator Garrett.
Senator Garrett, 2 minutes and 45 seconds. Senator Garrett waives use of that time. Senator Scheer, you're recognized.
Thank you, Mr. Lieutenant Governor. I rise today to discuss a little bit about perception, because perception becomes reality. We've all been inundated with emails. I probably had 50 or 60, 70 of them this morning. I read the first 10. Every single one of them had to do with smoking marijuana. The general public, and rightly so, because that's what the original bill talked about, thinks this is about smoking marijuana. It's not. It has to do with oils, has to do with a pill. I can appreciate Senator Mello's comments about trying to do something for children and mothers and parents that have these afflictions, and I don't disagree. But let's not forget that this isn't the only option that we have this year. I'm speaking on behalf of myself to the extent that I did co-sponsor another bill that has to do with the cannabis oil and having a study done with the UNMC to find out exactly if and how well it works. Now granted, it's only 50 or 60 people, I can't remember what it might be. Perhaps it might be, you could have additional dollars contributed to it that would allow more. But that's essentially what Senator Garrett's bill is going to do. It talks all about the oil. It does not talk about smoking. It doesn't talk about any type of leaf product. It is oil. We have another option. We don't have to feel like we're deserting family and young people and children if we don't support this bill. This is a very loose, non-controlled bill. You have another opportunity that will be coming forward that has very tight constraints, will be a medically tested format that will allow us to specifically and scientifically determine if indeed this works. I don't probably have a question that it does, but I think we should be able to prove that before we start wide use consumption of something. There's been a lot of things that have gone in the market that were supposed to help a multitude of different things. And the FDA and society and the public ended up with tons of lawsuits because it raised havoc with bodies, it didn't do what it was supposed to do, and it had side effects that were worse than the solution that it presented. Don't feel like we are abandoning those people that need help simply because you do not support this bill. There is another opportunity. I believe it's a legitimate opportunity. And I think it even is more so. There was a wide discrepancy when Senator Garrett first introduced his bill. At that point in time, it was, do we want to have full-fledged use of marijuana, including smoking and everything else that went along with it for medical purposes? That's not what the bill is now. The bill is strictly the use of oils, and I'm assuming, I've not asked Senator Garrett, but I'm assuming the pills they're talking about are oil pills.
1 minute.
So both bills are similar. Thank you, Lieutenant Governor. One does not have the requirement, the restrictions, the format in place to control it. It's going to be a trust me. Trust us. We'll do what you think we want. I don't know that I do trust those people without some type of confinement put on the use and availability. We have another opportunity. And again, this is me coming forward. This was not at the behest of anyone else, but I am a co-sponsor of the other bill, and I think we do have a viable alternative to this bill that essentially has the same product available, but it's going to be under medical supervision, and it will be a tightly controlled study. I've talked to parents. I did talk to the same people you did.
Time, Senator.
Thank you, Mr. Lieutenant Governor.
Thank you, Senator Scheer. Senator Brosh, you're recognized. Senators, this is your third opportunity.
Thank you, Mr. President. And colleagues, I just wanted to finish reading what I had said earlier, that individuals who are in the medical industry, they are caring, they are concerned. Their duties are sworn into healing, and I'm just surprised that we are not going to trust those who have devoted their lifetime to helping heal others. And when Senator Bloomfield had mentioned again about things we do, but we're not that, I want to see if he can just give me a head nod, but you've driven truck for many years. You retired, correct? Do you think the senators here would know more about truck driving than you do and could put together a package? Head nod, yes or no? He doesn't know. Okay, well, there are people who work in an industry who dedicate their lives. And what I'd like to now is read to you what the American Academy of Pediatrics has to say about this. And they've raised serious concerns regarding the lack of scientific medical research regarding medical marijuana and its effect on adolescents. And they stated the following, and I quote, "There are numerous reports in the popular media by parents regarding the successful use of medical marijuana by adolescents for the treatment of a variety of health conditions, including attention deficit, hyperactivity disorder, anxiety, depression, and autism, as well as anorexia, chronic pain, and post-chemotherapy nausea and vomiting. However, there are no data concerning rates of adolescent use of medical marijuana through licensed dispensaries. There are also no published studies on the use of marijuana in the pediatric or adolescent patient populations, with the exception of one study evaluating the source of marijuana used by adolescents receiving care in a substance abuse treatment facility. So in short, there are no published studies on the use of cannabinoids or marijuana to treat health conditions in children or adolescents. Cannabinoids may be helpful in adults for certain medical conditions. However, for pediatricians, the recommendation of medical marijuana is problematic for the following reasons. It is not regulated by the FDA. Its purity and the THC content are not consistently verified. And because there are only small case studies available, the risk-benefit relationship cannot be determined. The position of the American Academy of Pediatrics is offering us very serious reason to be cautious, colleagues. There are some asking, why would I oppose this bill? I think the concerns raised are very reasonable, and they're ones being offered by the experts of the field. And they're being offered, and this is why there should be opposition to this bill moving forward. Thank you, Mr. President, and thank you, colleagues.
Thanks, Senator Brosh. Senator Pansing Brooks, you're recognized.
Question.
Question's been called. We see 5 hands. I do. The question is, shall debate cease? All those in favor of ceasing debate, vote aye. Those opposed, vote nay.
It's 4:44 in the afternoon.
There's been a request for the call of the House. All those in favor of placing the House on a call, vote aye. Those opposed, vote nay. Record, please, Mr. Clerk.
33 ayes, no nays, Mr. President, to place the House under call.
The House is under call. Senators, please record your presence. Those unexcused senators outside the chamber, please return to the chamber and record your presence. All unauthorized personnel, please leave the floor. The House is under call.